Right, thanks very much. Thank you very much, Soja. I'm sorry I have to give the first talk and then I have to rush because of another meeting, so I couldn't stay and hear the other speakers. I'm sorry about that. Now, I was asked by Soja, she's in charge of this meeting, to talk something on myopia. But yesterday, my colleague, Professor Gai Chen, in a genetic meeting, had shared some of our data already on myopia genetics. Right? But then I'll mention some, and also I'll go back to the beginning, how we organize these cohorts for our genetic studies on myopia. And then lovely to have you around so that hopefully we could have the opportunities for collaboration. Right? So myopia, very, very high prevalence in the world. Right? We all know that. And in Hong Kong, extremely high. Unfortunately, we are among the top, if not the top city in the world that has the highest prevalence of myopia across all ages in Hong Kong. So we have good reason to study myopia. So that's how we organize our myopia study. We give ourselves a task on myopia prevention at childhood. So we start our work in this particular work. We do more on childhood myopia than elders, but also, of course, we have to do elders. But still, for the childhood myopia, that's our major attention. We organize ourselves in 3 studies. One is the big one, that is the Hong Kong Children Eye Study. It's a territory-wide across all districts of the whole of Hong Kong, which is a city in itself. The parent, children, and their parents, so family, children, and parents together. We study the risk factors, lifestyle, parental style, and mental health, public education, together with community service. So it's involved in a big territorial study since 2015. I'll come back to that later. And out of this study, we set aside the Hong Kong Children Eye Genetic Studies to establish the biobanks for children and their parents, right? So for this, we conducted GWAS and whole exome sequencing materials, genotyping myopia genes. So this is for genetics, the Hong Kong Children Eye Genetic Study, which is part of the Hong Kong Children Eye Study. But then these are children, families that we have children and parents with complete ophthalmic data. And out of this, we also organized the low concentration atropine for myopia progression study, so-called the LAM study, that we utilized 0.05%, 0.05%, beg your pardon, of atropine, low concentration, and then we have conducted randomized controlled trial and with placebo for this atropine study. But we also have a genetic dimension in this study. So the study cohorts, how we organize it, we have so-called patients and controls, right? However, it's still the whole of Hong Kong. We recruit without any selection people that could come to us as a territory-wide population study. Recruitment study subjects were patients and controls, but then the patients are from the children, controls also from these children, and then we do association studies, we do examinations. Now, for some patients, we would have complete imaging examinations. Some, for example, the thyroid eye disease patient, we have endocrinology. But all in all, we have general demographic information, complete ophthalmic investigations, and then we collect all the necessary data. So that's the study itself. We started in 2015 up to today, it's still going on, at the CHK Eye Center based in the Hong Kong Eye Hospital. And we haven't reached 50,000 yet. It's 48,000 something, right? It's going on. Our aim is to complete over 50,000 families. That means we have at least 50,000 trials, i.e. a child. Now, not necessarily 50,000 trials, right? That we may aim at that, but then of course we have parents that are also myopic, so we can't form trials on that. So that's a bit of a misnomer. But still, we will have 50,000 children between 8 to 10 years old, and actually now we have expanded it to 3 years old. And both of their parents, so we all have their parents together. It's territory-wide among all the districts in Hong Kong. So on every Saturday from 9 a.m. to 6 p.m., we could invited 100 families, right, each Saturday to come into our eye center and to do complete ophthalmic investigation. We take blood and things like that. And since 2022, we extend our study to 3 to 6 years old children, and also special education need children and ethnic minorities. So we do that. And so they, instead of going out to recruit them, we invited them in so that they will have complete ophthalmic investigations in the clinic, right, as if they were patients. And of course, we collect blood from children and parents. And also we collect buccal swab if we can't take blood, but essentially we take blood for DNA. And we also work on the conjunctival swab for ocular microbiome, which is another study. So for the lifestyle, we give out detailed questionnaires before they came. I emailed them or by text. And then they came back. Then all these questionnaires, fill in the details, 350 questions are all assistive. So we train medical students to go through the questionnaires with the parent to standardize, the information, right? So we do that, and also it's part of education to the parents. So we do that. So each family will spend about 45 minutes, a face-to-face interview, and complete these questionnaires while they are with us, while the child and the parents receive ophthalmic investigation. That's what we do. And in the meantime, because we need to have people coming in, so we have strong community, or what I would say heavy community engagement in the TV, and then public education. We go to the mall. Go to the malls, we still do that, and also we go out, and then it's more on publicity, right? That's what we do all over the city of Hong Kong. So that's what we've been doing. Even today, we're still continuing until we reach the goal of over 50,000, right? So on the genetic part, so colloquially, we'll say it's the genomics or scientifically, of refractive error in general, myopia, based on spherical equivalent and axial length, cycloplegic refractive errors, and then endophenotype, and also we also follow this every 3 years. So it's also myopic progression, right? And also part of it, we do the atropine treatment response. I always have to mention, we always mention this first paper that we published. This is actually 2,055 trials, right? But then, of course, we have other families. I think this is not trials because some parents are myopic, so it is wrong. It should be 2,055 families, right? Parental myopia. So we can see that very clearly that there's a dosage effect, right? So when both parents are highly myopic, the children have a high likelihood of myopia. So this is what we have done. And then we went on to do some genotyping with axial length. And also we have, some children have 3-year follow-up. So all in all, we have done this genotype studies. So I published all this. But then we went on to do genomics, and then we conducted GWAS of these children. Some have received atropine, and some have responded. So we have done this. And then the data have been out, and now we are working on replication. So it's not published yet. So we haven't published this data. And we have data in the longitudinal studies, 3-year data, 1,000 study subjects. So we have this needs, and now we are doing the validation in another cohort. So that's what we've been doing. Also ocular trace, corneal astigmatism, and the corneal curvature, and all this detailed endophenotype. We also did meta-analysis, GWAS for that, and the myopia and trait, and also the genomics for atropine treatment, the low dosage atropine, the responses. The study was on 262 children. And then we have the treatment response, and we can combine meta-analysis. So we have all these needs now, and then we are organizing a study for the atropine treatment for validation, right? And we have the treatment responses. So we have conducted a randomized control trial published 2 years ago, and now we are replicating this genetic GWAS list in the LAM2. This another stage of our another phase of our LAM studies, right? And the number of study subjects went up to 400. So we're doing that. So our conclusion is we have so far have accumulated some SNPs with significantly associated children baseline equivalent, and then we have association baseline AL, axon length, and chronic curvature, and there are suggested associations with some multiple SNPs, multiple genes, but they are all under validation now. So hopefully, give us another several months, we'll complete that, and we should be very glad to publish some of findings. So I acknowledge the team that in Hong Kong in the department that work on this, and then we do need not just validation, go on to do deeper. So I've called for collaboration, all right? And welcome to Hong Kong in the next APAO in Hong Kong, and this is Hong Kong at night. So thank you very much. Thank you.